Welcome back from the break. This one is going to get interesting. We're 11 minutes already offset, but we'll be joined by Dr. Sherif Okyer from Amin Scientific Herbal and Alternative Medical Center or Hospital. I got it right. Yes, and he's joining us as we do every Wednesday. And today we're talking about erectile dysfunction. Are you a man or watching us? And this is a problem for you. If you're a woman watching us and this is a problem from the other side for you, you need to watch this. And possibly you need to call the numbers when we are done. I am inciting the desire in you, yes, the conversation in you before we get into it proper. No, good morning and welcome.
Good morning. Thanks so much. Thanks so much.
You got to yourself.
You know, I'm learning from you, so.
Anyway, today's conversation, on a more serious note, when you do a survey,
yes,
what's the percentage like of men who have erectile dysfunction? And I also want to know how many women are able to come out and come say that my man has this issue.
I think it's one very important issue that we need to pay attention to, because at first, when you are looking at conditions like erectile dysfunction, then probably you are looking at the age, because of course when you're aging, a lot of things changes within the system, which predisposes one in getting some of these things. But the very critical point about this condition is the young ones nowadays. Remember that it will surprise you that just last week, a young man as young as 22 came to the facility.
22?
Yes.
Okay, you're joking.
I am telling you, that is how serious some of these situations has been. And the only complaint is that he can't sustain or get erection or satisfy his girlfriend, because he's having challenges with erectile dysfunction. And that is, I was shocked myself, because looking at the age and the fact that he's very young, and that is not the only case. You see, even young people, 30, 32, 35, 40, for the 50 and above, it is very, very, common. So it is, when you look at the rate at which people are presenting with erectile dysfunction, it's very, very alarming.
Wow.
Yes.
So as we're talking about, Nana, I was asking of her, what is the problem? What would we term as erectile dysfunction? Yeah. Is it that it cannot there cannot be an erection, or it cannot bear?
Okay, so yes, so erectile dysfunction is actually a situation where a man can't get or sustain erection to satisfy his spouse or his wife, girlfriend, or whatsoever. So if you're a man and you are unable to get erection, that is one. There are some people who can get the erection, but they can't sustain erection. That is two. So it is either you are not getting the erection or you can't sustain erection. Because some people can get erection fine, but they can't sustain it. So all these two situations can be, classified under erectile. So under erectile dysfunction, we are looking at these two things. Either you are not getting erection or you can't sustain erection.
Doc, talking about the sustaining it as the sustainability, is there a particular duration that it is supposed to be able to sustain the time before it's whatever?
Yes. So this conversation is very important, because now when you talk about sex, especially among the young ones, there's this myth around how long you're supposed to last in bed as a man and all those things. And I always tell anyone that I meet that don't be fooled by someone, because a lot of times, especially with the young ones, when we meet, we'll go like, Charlie, media, if I get you like 1 hour, like 45 minutes or 30 minutes.
Yeah.
But ideally, for an ideal sex, a man is supposed to actually last for maximum 7 minutes.
Okay.
So if you're a man, yes.
I'm not laughing.
So if you're a man and you are watching us and you are able to get erection and sustain it for up to 7 minutes, then I can conveniently tell you don't have any problem.
Oh,
okay.
Yeah.
Okay.
So situations where you go way below the 7 minutes, you know, there are situations where even during the course of romance, you know, then you get there, you ejaculate. You know, some people in an attempt to penetrate, then they ejaculate. There are people, it is even difficult for them to even get the erection. That is where we can say you're having erectile dysfunction. You understand?
Okay.
Yes.
Okay. That's good.
So that understanding is
it's clear now.
Yeah, it's clear now. Okay, yeah.
Yes, but one
so Lai is asking if 4 minutes is a problem, but now we've established that it's
so for
7 minutes.
7 minutes.
That's normal.
So don't be fooled. That's me. I go 30 minutes. I go 1 hour. All those things are fallacies.
But
it is
4
not
minutes, like 6 minutes and below.
There's a problem. You understand? So for ideal sex, it's 7 minutes.
7 minutes.
You understand? So if you go way below the 7 minutes mark, then you're having issue. But ideally, if you are not on any medication, if you are not taking any medication to enhance your sexual performance, and you go above 7 minutes to, it doesn't mean you have a problem. Because I always say that, you know, for a man to get an erection and to also be able to sustain it, it involves a whole lot of processes in the system. You understand? So, for example, if men are, you know, things that we see, things maybe by touch, or when there's these activities arousals that goes on, it involves the brain. So the brain would have to interpret this action. And then also from there, if there's this sensation, this activation of, you see something also that gives you the arousal, then the brain will tell the heart, no, there's this thing that is supposed to go on. So at that point in time, your heart has to be in a good, you know, condition to actually pump blood to that part of the body. And you know, when blood are pumped from the heart, it moves through the arteries. So your arteries has to be patent. If you're having issues with your arteries, blockade, fat and all those things, it could affect your erection and your sustenance. Now, when blood moves into this part of because the penile organ doesn't have any bone, it's just a vascular tissue. So when blood moves in there, we all know for a normal circulation, blood gets to the capillaries and moves back within. So when there's exchange of gases at the capillary level, it moves back. But for you to get erection, blood has to stay. So now when blood moves into your penile, that will cause, you know, erection and all those things. There are some hormones that has to play some role for the blood to stay. There are some muscles in the penile tissues that is supposed to also play some role to help, you know, sustain the blood that has moved into that part of the body. And for you to do whatever you're supposed to do before it comes back. You understand? So it actually involves your brain, it involves your heart, it involves your artery, it involves some nerves, it involves some hormones, and even involves your emotions.
Wow. And you guys are really
you understand?
You guys.
Yes. So for a man to actually suffer erectile dysfunction, it can come from all these things that we are talking about. It
involves a lot of things.
Yes.
I think we'll take the causes one after the other, because if the whole body has to go through this process, as in your mind, your heart, and the blood, everything, the causes, I'm guessing, let's say, if a man is absent-minded, of course, cannot get erectile. The erection wouldn't come up.
Exactly.
So automatically, the stress, I'm guessing, will be part.
Exactly.
Okay. So
so that could be like the psychological part.
Yes. The psychological part. So stress can be one factor that could lead to some of these things, and then also situations like when someone is it's not even having money and the person is even thinking too much. Yes, it could.
Money.
Yes. There are some men, if they don't have money, their this thing doesn't get up. So yes. So
I think it has to do with the brain. Psychologically. Absent-minded.
And fear.
Okay.
Yes, fear. Because, you know, over time I realized that some men, because of some encounters that didn't go down well with them, has left some kind of fear in them. So anytime that they are in an attempt to enter into that act, it dawns on them. And that has been very detrimental to their sexual activity. So fear is one of the causes of erectile dysfunction.
So now we have stress, fear.
Yes.
And what else?
So
everything that has to do with the mind.
Yeah, I guess so far what Doc has talked about would be the
psychological causes.
The medical
so
yeah, let's get to the medical
some of the medical, there are some underlying causes like so if you're having issues with your heart, you understand, so your heart should be in a very good condition. So any heart-related condition that affects your blood circulation in the system can affect your sexual performance. If you're having issues with your arteries and all those things, it could also affect your sexual performance. There are situations that has to do with the nerves. So if your nerves are at fault, it could also affect your sexual. Last week we were talking about peripheral neuropathy, and we mentioned that some of the effects that peripheral neuropathy brings is erectile dysfunction. You understand? So if the nerves are affected, it could also affect your sexual performance. There are situations where we call it varicocele, when there's dilatation within the arteries, the blood vessels within the penile region. Now, when that thing happens, what actually happens is, you know, there's a quantity of blood that has to move into that part of the body at any point in time when there's an erection. So now when there's dilatations within these vessels, when blood moves to that part of the body, because of the dilatation, the space up, the blood wouldn't be sufficient enough to cause a very strong erection. You understand? And this situation can also lead to erectile dysfunction. And even in that same varicocele situation, because of the fact that the dilatation has been caused within that part, you realize men with those situations, with little stimulation, then they ejaculate. So varicocele is also one of the causes of erectile, you know, dysfunction. There are people who engage in masturbation. Yes, so if you engage in masturbation for a very long time, it could also predispose you in erectile dysfunction. There are situations like, there are some medications that we take for some conditions, some antihypertensive drugs, anti-diabetics drugs, and all those things, which in effect could cause some erectile dysfunction.
So all these things, is it permanent? Like, can it be permanent?
Erectile dysfunction is actually treatable. Especially if you're able to identify the cause. And you know, one funny thing about erectile dysfunction is, over time I realized that so many men, when you actually listen to their problem and you do a comprehensive diagnosis on their system, you realize not all of them needs medication when it comes to treatment of erectile dysfunction. So it is not every man who suffers erectile dysfunction needs medication. Yes.
They need money.
But of course,
maybe it's not money, but there are things going on.
Psychologically, you need to talk to them. Some people, you talk to them, you give them placebos, and they come back and tell you, dog, and you ask yourself, how many people are going through some of these situations? And they rely on, you know, buying medications. So I always tell them, you need to identify what is causing your problem before even trying to get medication, you know, for yourself. Because you rely on some of these medications, and it will get to a time, it will actually cause impotence. It's a time that you can't even get the erection at all, that nothing can be done about it. So we have to be very careful when it comes to the situation.
There are lots of questions. I don't know today, for a funny reason, so many questions are
coming into your
but then
right?
we can't ask all the questions.
We can't ask all of them today. Maybe we'll keep them, unless when Doc comes, we'll probably do a first session by answering all of those questions. But Doc, you said that this can be treatable.
Yes.
And of course, your outfit is helping with that. So let's go through that. If anybody wants to treat this erectile dysfunction issue, how they get to, of course, the numbers on your screen, you can call the numbers and
Dr. Sherif will answer.
Assist you. So let's wrap it up.
Yes, so yes, if you are watching us this morning, if you're a man and you're having issues with your sexuality, you are not able to get it or sustain erection, and it's causing a lot of problem. your house there's a lot of unrest in the house because of this situation, I entreat you to come to Amen Scientific Herbal and Alternative Medical Hospital. Because I always tell the people that Amen, we don't give aphrodisiacs because we don't believe in that. We believe in identifying the cause of the problem, getting treatment to that thing that is causing your problem to help you get your normal strength as a man to perform as a man. So just come to Amen Scientific Herbal and Alternative Medical Hospital to get solved your erectile dysfunction. We are all over Ghana, from Bolga up to Accra here. And in Accra, we have 2 branches at Domain, close to the Senate Flats, and also at Lashibi Klagon, close to the Ashama Underbridge. The numbers are on your screen. Call any of these numbers, and we'll direct you to any of the Amen Scientific Herbal branches close to you to get treated your erectile problems or erectile dysfunction.
It's interesting how some of my friends this morning are fully awake and they are sending questions. Ask the question probably next week.
We'll do that next week, but okay, we've got to go. Thank you so much for coming this morning. And it's been an interesting conversation on erectile dysfunction. As you mentioned, call the numbers on your screen, and or you can visit any of the branches across the country. So that's Dr. Sherif Okyeere from Amen Scientific Herbal and Alternative Hospital.